Good morning and welcome to the Cherilyn Lee Health Show. I want to thank everyone for joining us this morning to another wonderful healing episode of the Cherilyn Lee Health Show. I have a wonderful guest with me today, and we're going to deal with a lot of testimonies as it relates to the healing process. And my wonderful guest today, her name is Linda Rogers, and Anzella Victoria is actually going to introduce our wonderful guest today.
Thank you, Dr. Lee. Today's guest is Linda Rogers. She is a doctor of natural medicine and a board-certified traditional naturopath. She is also a board-certified alternative medical practitioner and is a board-certified diplomate in integrated alternative medicine and is part of an elite group of practitioners who are certified lifeline practitioners. In addition, Linda Rogers is a California certified massage therapist and a nationally certified therapeutic massage and bodywork therapist, specializing in craniosacral therapy and myofascial release therapy. Linda Rogers is also an energy medicine practitioner who is able to help people discover blockages in their bodies and life that is causing pain, fear, stress, illness, and dis-ease. Then showing them how to shift and raise their frequencies and vibrations for optimal health and well-being. Linda Rogers has been in the medical, dental, TMJD, physical therapy, chiropractic, alternative medicine field for over 25 years, helping people to bring health, healing, and wholeness back into their lives with natural, energetic therapies. Welcome, Linda.
Thank you. It's a pleasure to be here.
And it's such a pleasure to have you. This is Dr. Lee again, co-host of the Cherilyn Lee Health Show. And I just want to say our topic today is, I really love this topic. Can you hear me now? You know what? Can you hear me now is so powerful. It's such a powerful statement because a lot of people don't hear those subtle symptoms. They don't hear what's going on. And then we have something called silent killers. But anyway, can you hear me now? Your body and life are speaking to you. Are you listening? Your body and your life are speaking to you. Are you listening? And so many people are not. That's why they end up with all these other major problems, because they're not listening to these subtle clues that can happen at any given time. So I love this topic. Can you hear me now? Thank you so much, Linda.
Well, as I said, it's a pleasure to be on your program, and I just appreciate and grateful for all the work that you do in the community and for all your healing abilities and your service. But yes, that's the topic is, can you hear me now? Because it's all about listening to what the body and our life is speaking to us. Because it's trying to tell us a message that something's going on. And we need to be able to interpret that language. What is
Most
the body
definitely
trying to tell us?
You know, and we spoke the other day, and we'll be talking about our bodies and life speaking, you know, how the symptoms speak to you and, you know, what's going on with fear and stress, you know, because a lot of times our body is speaking to us through the fear and the emotional upset and addictions and chronic illness. And we look at the word dis-ease. So we're going to be touching on quite a few things and in ways our body and our lives are communicating with us so that we can pay more attention so we can go through this and better, you know, and heal through this time in our lives, which I think is so important. And I really enjoy, and I'm so happy that you considered being a guest today. And we've been knowing each other for years. And we finally got together last week. And like I said, I'm so happy that you're here today. You know, we discussed a lot of case studies, and I think it's so powerful. And that's why I want to kind of start off maybe. But first of all, Linda, how did you start? What promoted you to get started in integrative medicine? I call it more of an integrative approach, of holistic approach. There's so many names for it they want to call it, but we would truly, you know, herbal medicine and natural medicine has been around since our ancestors. So I don't know why they want to even call it an alternative. It is not really an alternative to anything. This should be it, you know?
Yes. Well, I started my journey back when I was a teenager, and I was reading books at home about like Dibs in Search of Self, which is schizophrenia child, or it was a book about a child who had cerebral palsy, and they were told to institutionalize him, but the parents said, no, let's do it ourselves, so they were repatterned them 24 hours a day, and they actually would cure them. You know, they would actually see transformations. And so I started off, I wanted to be a physical therapist, so I started off in junior high school, went out to physical therapy department at the community college to ask what I needed to do to go to school, and they created a position for me, so I'm at physical therapy in my junior, senior, 10th, 11th, 12th grade, weekends, vacations, such like that. And then I went to work for the chiropractor at 19, and did his front office, back office, and at the end of the day, I would go in there and give him adjustments because he'd worked all day long, so I would give him adjustments. And then I went down to Texas. I'm originally from Nebraska, and I worked in the dental office, and he was in holistic dentistry back in the 80s, you know, how
You're
all the different
kidding.
things
In the 80s?
in the 80s. And he
Wow.
would talk about how the TMJ, our jaw joint, would go out. There was a woman that he would put her jaw joint in and it would go out again, and we found out she was drinking 6 Pepsis a day, and as soon as she had that sugar on the tip of her tongue, her jaw would just go right back out. So we were doing holistic dentistry back in like I said, in the 80s. And then I came out to California, and I worked for a TMJ doctor there, and I did his physical therapy.
You know, not to
His,
cut you off, you're
no,
moving very fast. I'm going to slow you down a little bit, okay?
eh, oh, you know, I just wanted to get it, but yes, so
It's okay.
I've
We
been
have
in the,
90 minutes. We have 90
that's
minutes,
fine.
okay? But
I've
let
been
me
in
just,
the
I want you
holistic
to
field for a
explain
long
to the
time.
patient what is TMJ. I know what it
TMJ
is.
is temporomandibular joint. That is your jaw joint, okay? That's the jaw joint that opens and closes your mouth. And when it becomes in dysfunction, it can cause pain, headaches, migraines, different things like that. And it all has to do with muscles, how our teeth are, our emotions, different things that affect us, our clenching, our grinding.
Especially grinding teeth at night. And a lot of people have that problem of grinding their teeth at night. Usually
Right,
somebody share with them and tell them they're grinding their teeth at night. But
right.
the
And they,
TMJ is it's very important because a lot of times people tell me I open my mouth so wide or I can't open my mouth wide, and they hear a clicking sound when they open and close their mouth. Because this is internet radio, and I always like for people to get a good visual of what we're doing and what we're saying.
aha.
Yes.
Yes, and so like I said, years past, it was called the great imposter because when the TMJ, when your jaw joint was out, it can mimic so many different things. You could go to the ear, nose, and throat because you had an ear problem, a throat problem. You could go to the root canal specialist, and have a root canal done. It wasn't coming from the tooth; it was coming from the muscles. So it's just it used to be called the great imposter, and it just mimics so many different things going on. And so it's still very vital. It's a very vital joint in our bodies that we use every day to chew and to talk.
Yes, most definitely. Have you seen a lot of TMJ connected with ringing of the ears?
Oh yes, yes. Because if your jaw is too far back, we have a little disc inside our joints that separates our bones from each other, and if that disc has gotten slipped out of position, similar to a clicking, popping sensation or locking, that lower jawbone would be back too far. It'll press against the nerves and cause it tinnitus or ringing in the ears. And then you also have some muscles, either a masseter muscle or a pterygoid muscle, that will also go into spasm and also mimic, cause ringing in the ears, noises in the ears.
Very good. And you've been very successful, I understand, with the type of techniques and therapies that you're currently doing.
Right, and that's where I was when I was working with the dentist. I am still in dentistry. I would do the physical therapy for the TMJ patients, and they said, well, you're so good, you should be a massage therapist. So I went to massage school. My first class, I put my teacher asleep. She was, we were short that night, and she was my subject, and she's like, I've never had that. No one's ever put me to sleep before. So that started my journey on massage, and then we went into body work, and I did cranial sacral therapy, myofascial release therapy, and I took all these things and put them into the dental office treating the TMJ patients.
Right. Now let's break that down too. Those two
Okay.
conditions. And let's, because like I said, a lot of our listeners, we do have listeners who are practitioners, but we do have a lot of lay people. And I don't want to lose them in the beginning of the show saying, I don't know what she's talking about. So let's just break it down for them, okay?
Perfect.
Thank
Perfect.
you.
So myofascial release is a technique, and we have a fascia system, and this is going to blend in beautifully with our topic today. We have a fascia system, which is a three-dimensional connective tissue web, goes all the way from the tips of the toes to the top of the head. And it surrounds every single organ, every cell, every nerve. Every single thing is surrounded by this fascia. When the fascia becomes injured, traumatized, or emotions get stored in the body, in the fascia, it will shorten up and will cause dysfunction. You can have a scar on the bottom of your foot, and that will cause you to have a headache in your head. And some people who thought they were having a heart attack was just the fascia was just tightening and tightening so much that it was strangling the heart. So the fascia is so critical in how we move through life. And like I said, it is the storehouse of emotions.
Well, that's good to know.
Yeah. So that's a body work, a very, very gentle stretching of the fascia to release it. And then you combine that with the cranial sacral, and we have cranial bones that become out of position, which then affect the flow of the brain and how that all goes throughout the spinal cord, and how our life is hampered if we have a cranial restriction. So all those things go hand in hand with our lives and our body speaking the language that it has with symptoms.
Okay. And I think you broke that down very nicely, considering we have a vast number of things to discuss. And if you just tuned in to the Cherilyn Lee Health Show with your host, Dr. Cherilyn Lee, and my wonderful co-host, Linda Rogers, and our topic today, can you hear me now? I just love that topic. Thank you so much. Can you hear me now? And a lot of people are not hearing anything. Number one, we get so busy we don't hear anything. Knocks on the door from God, or or even our subtle symptoms that we have within ourselves until they become vast. And that's why we're doing this show today, so that we can help eliminate some of that. And some of the case studies that you have dealt with over the years, last week when we had a conversation, I thought they were so profound. So let's kind of jump into some of the case studies that you discussed. And we're not discussing, patients' names or anything, and some will be altered. It might, so we can spare the
That's
privacy
right.
of the person. But I thought they were really, really phenomenal. And I think a lot of people are going to see themselves in some of this because of the fact we can talk about all these other wonderful things, but we don't know a lot of times what happened to us in utero before we're born. We don't even know what's happening when that egg and the ovary and the sperm, once it meet, what's really happened. So we look at miasm, or things that in homeopathic they call it more miasm, but what's really happening to us when we first created, and what's going on with that mother, that father before that child is born. I had a conversation with a gentleman a couple days ago who is in the process. He just got married, and he actually started asking questions about, he was unaware that what was going on in his life right now is going to affect his baby. He was
Oh,
unaware. So, and he's listening to the show today. So he's
good.
happily married and going to get ready to haven't started his family yet. So this is going to be a great show for him.
So let's go back real quick just to set the stage. When we talk about, is your body, can you hear me now? Your body speaking to us, are you listening? What happens is we have a little bit of a symptom come up, and we say, that's nothing, I'll just ignore it. And this is similar to standing on the train tracks. and someone says to you, the train's coming, get off the track. And you're like, ah, I'm fine. And then you go through life and you have a few more symptoms come up, and someone's saying, the train is coming, like, oh, I'm fine, I'll just ignore it, I have so many things to do. And then pretty soon the symptoms start to speak louder and louder and louder, and someone is now yelling, the train is coming, get off the track. And you're like, oh, I'm fine. And then all of a sudden the train comes and it hits you. And now you're flattened. Now you can't work. Now you can't function. You have fibromyalgia. You have chronic fatigue. You've got something going on that now you have no choice except to listen to see what's going on. What is your body trying to speak to you? And that's why it's so important to listen to that first little twinge, that little thing. What is your body trying to say to you? Have you done too much? Did you sleep enough? Did you eat the right foods? Are you hydrated? What's going on, and why is my body speaking to me in that way? And then to go with what Cherilyn was just speaking about, who we are today is not us. Who we are today, what they talk about is the first 6 years of your life where we are imprinted, which is how the brain is, where we have to go through a delta state, a beta state, a delta, an alpha state in our first development of our years, but also before the first 6 years of our lives. Before you were conceived, were you planned? Was it love? Before you were conceived. Then the moment the sperm hit the egg, was it love? Was it makeup sex? Was it rape? What was going on the moment the sperm hit the egg? And then the moment that they found out they were pregnant with you, and they're like, woohoo, we're pregnant. It was like, oh no, we're pregnant, shoot. And then the first year, then the 9 months of your life in the womb, what was mom's emotion? What was dad's emotion? What was going on in the world? That creates who you are. And then the moment of your birth, what was going on in the moment of birth. Now the first 6 years of your life, that all creates who you are today. And that's how, so go ahead, Cherilyn. So I wanted to lead you into that. So that's how we are, that creates who we are today. All those different things leading up to this moment.
Right, exactly. And we have discussed this, and I have, been studying this myself. It started with my own children, who my oldest daughter is 37, 36, 35. So, and just knowing where I was. And then I start doing some research later to find out a lot about what's going on with the parties prior to having children, and then during the 9 months of carrying them, because of the fact that it has a lot to do with their personalities. I found out later, firsthand,
Right.
a lot of that. So it's, and then, what, there was one situation that you shared with me with a person, I think it was a prostate issue.
Yes, and I was about ready to tell that story. Anyway, there's a young man came to me, and he had testicular cancer. And it was several years ago, and he had treated it with chemotherapy, radiation, and some surgery to remove it. And he found me through some friends, and they said, do whatever it is that Linda, does for you. And so he was open. And what we found out is somewhere in his abdomen, he had anxiety, and it was his father's anxiety, and it was 30 minutes after conception. So we released it. Then we go on to find that there was anger in the body, and it was mother's anger, and it was 3.5 weeks after conception, and we scanned his body, and we found out it was in his testicles, okay? So we had him hold that area and his reflex of his arm, and what we're doing is we're doing muscle testing, kinesiology muscle testing, to see what reflexes are weak in the body, what organs are weak. And that was mom's anger at 3.5 weeks after conception. So we released it, and we'd finished our session. He walked me to the car and he said, well, you gave me a lot to think about. And I said, well, once we released it, there's nothing more that we need to worry about, think about. He said, no, you explained my life. I said, what? He said, I was never wanted. My parents came over from another country to this country, and my father, 30 minutes after, conception, there's anxiety. He's like, uh-oh, did I use a condom? Uh-oh. And then when mom missed her period at 3.5 weeks after conception, there's anger there. He said, and it manifests in his testicles. He said, I was never wanted. So now what we were able to do is to release that root cause. And now cancer will not come back in another area. Okay? It's
Yes.
because we've released the root cause of why it may have manifested in the first place. So that's just one example of just 30 minutes after conception, dad's emotion, 3.5 weeks after conception, mom's emotion that create, and we get to store it in our bodies.
And not knowing what we're doing to a life that is still developing. We don't even know that the effect that we're having on this new fetus, that it's not even our embryo, that's not even started to develop. It's a major, it's actually something major that happens to that child in utero.
Yes. And having children is such a miracle anyway that we seem to sometimes forget about it. It's like, oh, here's just another child, but from the moment, I mean, it's just a miracle to have this child and grow inside you and all these things. So we need to be so mindful of what it is we are doing with our diet, our life, our exercise, our lifestyles while being pregnant. But
Exactly.
interesting, I had a young lady just at a seminar over the weekend, and she says, well, because I had helped this other gentleman, a chiropractor, and she said, well, work on me. And so we found out that there was an emotion when she was 5 months in the womb, and it was like a failure or something like that. And we scanned her body, and it was in her reproductive organs, in her ovaries. And she says, oh, my gosh, she says, I have had an ovary removed, or, right, she'd had a cyst on the ovary. They've been treating it. They can't really get it to dissipate or anything like that, and there's something going on the other side. And that's where she was storing this emotion for 32 years from when she was 5 months in the womb. And she's like, oh, my God. And I did not know her history prior to finding that out in the body.
Yes, yes. I've had similar situations with a person female, who was actually physically abused by the father. And everywhere in his body where he had bone cancer, he actually told me, because I actually do something a little different, and I had him place his hand over the area where he had the pain and where the cancer was stated in his bone, and ask what was the purpose, and just
Uh-huh.
get deeper into what happened. And then he started telling me, that I have not forgiven. I have not forgiven my father, and this is where he beat me. This is where I remember the extreme pain in my back and in my hip from when my father used to beat me. And he still, out of all those years, had not let go of that anger to forgive him. So forgiveness has a lot to do, and it will lock. And when I tell people on the healing aspect, it's like peeling an onion. There's many layers. We have to look at the physical, we look at the spiritual. Most important, I think we need to start off with the emotional, because that's usually the root cause, is the emotional. And then we can do the environmental, the detoxing. It's just so many levels, but you start off with the emotion, and then you just take it from there so you can help that person to get into a better journey and healing.
Well, and so let's explain that a little bit more to your listeners. And the reason, because you're like, what is this where, conception in the womb, whatever age that you are, but we're water. We're like, 80, depending on what source you are, 80 to 90% water. So we're made up of water. And if your listeners have ever seen Dr. Emoto's work, which is Messages in Water,
Yes.
he was in the movie What the Bleep,
Hmm.
where he would take these water and freeze them into crystals, but he would write words on the where the water was at, or he would play music to it, or show it a picture or something like that, and it would create these either beautiful, beautiful water crystals or very ugly water crystals. And so the same thing happens to us when we are in negative situations or negative thoughts, and we have 60,000 thoughts a day, and they're positive and negative, but thousands and thousands of thoughts a day, that gets imprinted into the water in our cells, right? And so that's how we take those energies on, is through the water in our cells. but it's also about frequencies, about vibration and such like that. So how those negative emotions can come in there is that fear, okay, is a constriction. We need to flow through life. We need to flow through our circulation system, our nervous system, our digestive system, our lymphatic system, and then this energy system, which is what acupuncture is based upon. And they all need to be open, need to be flowing. And the number one cause of blockages is constriction. Constriction.
Yes.
And fear is constrictive. Okay? Fear has a frequency vibration of darkness, of constriction. And so we can go in there and not only fear, but sadness, sorrow, depression, bitterness, guilt, resentment, hopelessness, failure, all these things are on the negative side. These are all on the constrictive side, and they'll
Yes.
constrict our flow.
Including boredom. A lot of people are not aware that depression and boredom, how that affects the immune system greatly.
Exactly.
Mm-hmm.
And then I was telling Cheryl on the way over here, I saw the billboard. It's for Will Smith's movie After Earth, and the catchphrase is fear is a choice. Danger is real, but fear is a choice. When we go through the path of life, we can choose love, we can choose fear. Love is expansiveness. Love has got high frequency vibration, and it just opens us up to so much. And fear on the other side is a constriction, but fear is a choice. And that's what Will Smith was saying in his movie. So profound. So that's how our bodies store our emotions, is through our water, the water in our cells. And every symptom, whether it's a physical illness, a stress, a fear, emotional upset, can represent an emotional experience buried in the subconscious mind.
Yes, indeed. And I want to say, if you just tuned in, because a lot of people are not used to our new time frame here, our new time period of coming on. We're on every Wednesday, 11 to 12:30 Pacific Standard Time. So if you're just tuning in thinking we just started at 11:30, we start now at 11 o'clock. So what we're going to do in a few minutes, we're going to kind of recap, just in case you just came on, because we just started this something new. But we have covered a lot of material, and we'll be covering a lot more. And our topic today is, can you hear me now? Your body and your life are speaking to you. Are you listening? Very important. Are you listening to your body? With my host today, Linda Rogers, and who has an extensive background. We're not going to go through that, but this show will be placed on the Cherilyn Lee Health Show .fm. If you go to the YouTube channel from there, all of our shows are archived right there, and you will be able to send this show to a friend, share it, and listen to it again, because it's going to be something that's going to be life-changing for you. And our wonderful sponsor is NutriMed Integrated Healthcare, and I want to thank them for being our sponsor for the Cherilyn Lee Health Show with your host, Dr. Cherilyn Lee. Just thank you so much. We do have a caller. Caller, can you state your name and where you're calling from? And thank you for calling.
Hi, this is Margaret, and I'm calling from Los Angeles.
Thank you, Margaret. Thank you so much for calling. And your question?
I'm sorry, I tuned in kind of late. What is boredom?
Well, boredom is a lot of times when people, and actually it's a part of depression. And when people just get so bored and they don't know what to do with their life, and some people just lock themselves. It's seen a lot of time after a breakup, or a person lose a job, or different situations happen. A person can become very bored, or they don't know, they don't have a quite direction in life, and they just sit around and they become very bored. And some people get locked within themselves a lot of times through boredom, but boredom really can affect the body also, because you just get stuck and not able to move. I don't know, Linda, if you have something you want to add to it.
No, boredom, as you were saying, is a byproduct of a low frequency, low vibration of something that has happened to us that we cannot overcome. And like I said, then we have a non-committal abortism, such like that, that we cannot feel and get back into life. Something that's keeping us, something that's limiting us, keeping us from really fully, passionately enjoying life.
And
And it's
how
usually
how would this affect your health? Is
right, and how that would affect your health is it decreases your energy flow. It decreases the flow through your acupuncture points, which feed your organs. Decreases the flow through your lymphatic system, your circulation system. Digestive system becomes sluggish. You know, just because we, like, as we talked about, have energies and emotions have energies, and that devitalizes our vitality. And that can come from a divorce, a job loss, something that has affected us on an emotional level. So, I hope that answers your question.
Did that answer your question, caller?
Well, so what you're saying is if something has affected you, find yourself just kind of bored and not knowing what to do, it's a sign of depression?
It could be a sign of depression, but keep in mind, it's sometimes the period of time. Now, sometimes people can get a little bored, and you can have a little time out for yourself and say, you know what, I just don't want to do anything. It could be defined a different way also. But when a person just, I've had a person just lock themselves in their house for 3 months because they said they was bored with life after the divorce, and they didn't want to do anything. They never came out the house for 3 months. So if you look at things over a period of time, then there needs to be an intervention after a period of time. So there's different levels of boredom, I would think. For a couple of hours, a person's bored. One night, you just say, you know what, I'm bored. I'm just going to stay home and maybe just do nothing, not answer the phone. That's not abnormal. But when you go over periods of time and people go weeks and days and just say, I'm bored. But when a person starts saying, I'm bored with life, that's a different story. Those people, you got to watch for suicide.
Okay. Thank you so much.
Thank you very much.
All
Did you
right.
have anything you wanted to add to that, Linda?
Well, no, and what I was trying to relay is that sometimes when life becomes too much, too overwhelming, and we no longer participate in life, which becomes to the outsider as a boredom, or we're bored with life, or we just want to, tuck ourselves away into our house and not be a part of society. Sometimes we've been triggered, okay? If we've gone through a divorce or we've lost our job, there comes in an issue of self-worth, self-value. Why don't they love me? I've never been loved. Why did they fire me? Different things like that. And we're triggered, and we're right back to a point in our lives where we initially had that emotion, and we didn't have tools. We didn't have strategies to help ourselves, and we find ourselves right back to that age. And so now all of a sudden our body and our mind doesn't know the difference between imagination and reality. It just knows we're 4 years old, we're 5 years old. We don't have tools, we don't have strategies. And we're like, wait, but I'm 35, I know better than this. But your body and mind are triggered, and they're reacting as a 4-year-old. And, disassociation, isolation. So that can be part of that, boredom. And as you said, left untreated, it can manifest itself or escalate into a full-fledged depression.
Yes, it can. Yes, it can. And, because as you had stated, or we have written part of your, as practitioners, that every symptom represents an emotional experience and buried within the subconscious mind. And, lets us know in the forms of other things that starts to happen. And you have kind of touched on some of that too, and we want to kind of keep going there because a lot of times people, are just not aware that how their symptoms and emotions are tied in together. Maybe we can talk, and we see things that are so common like diabetics. No, I can go into a different way on the emotion, but I want you to kind of talk about how do you work with diabetics?
Well, and interesting, I've had several diabetics that have been able to get off medications such like that. When they talk about emotions and the pancreas, and the pancreas is the part of the diabetic model there that doesn't function as properly as it should. A lot of times they talk about pancreas is about the sweetness of life. Okay, that
Yes.
we've had something happen in life where there's more of a bitterness as
Hmm.
opposed to sweetness, and so
Yes.
therefore it affects the pancreas. And then when the pancreas is depressed, or not depressed, but when it has a low frequency vibration in the pancreas, and it doesn't have a vital life force, and we have emotions stored in there, then it doesn't function properly. So, and with what Cherilyn does at her health center here, but most people don't understand that a new pancreas, we can get a brand new pancreas in 26 weeks. In 6 months' time, we have a brand new pancreas. So what I tell to my clients is stop doing what it is that you're doing to get yourself there in the first place, which means clean up your diet, clean up your lifestyle, do your supplements, do the things that you need to do. Take care of the emotions that are stored in the pancreas, and then when we remove all those different things and help to heal it, we can recreate a brand new pancreas in 6 months' time that doesn't need any medication, that has all the functioning that it needs to have, because our body is so magnificent, it can regenerate itself. And in 7 years, we have a brand new body from top to bottom, stem to stern. 7 years it takes to create a brand new body. So when we
Nice.
get out of the way and we remove those blockages, we can recreate the original blueprint of health.
Now, I really love what you just said about in 7 years a brand new body. So we send a brand new body. It will be the same thing with a person who have glaucoma or yeah, decreased visual acuity and not being able to see well when you're speaking on a brand new body.
Right. Well, like you said, the skins in our skin cells regenerate in 24 hours. As I said, the pancreas is in 26 weeks, and there's different things that the bones take 7 years. So that's why in 7 years we remove all the blockages and clean up our life and our lifestyle and our thoughts. Then our bones will regrow, a brand new regrowth of bone in 7 years. But with eyes, okay, so let's talk about eyes for a moment. Let's do a testimonial for eyes. And this is
Wonderful.
before I did the lifeline technique and some of the techniques I do now. I also do emotional freedom technique, and what that is developed by Gary Craig, and he talks about the same thing. Is we have these blockages through our energy system, and they're put there from negative thoughts and emotions. So I'm at this woman's home, and she had just come from the doctor, and he says, you have a diagnosis of glaucoma. And she's like, oh my gosh, I have glaucoma. So we're sitting there, and she told me the story and how upset she was, and we're talking, and I said, well, what's going on in your life? And she says, oh, my daughter, we give to her, and she just takes. And so the emotions that she was discussing was, I'm resentful, I'm miffed, I'm let's see, I have grief, I have sadness, I'm upset, I have rage, resentment, because we've given to her all these years, and she just takes, and she's not appreciative of all. So we went through and we took a look that the meridians that are around the eye, your bladder meridian, which is the
Yes.
beginning of your eyebrow, stores trauma, grief, sadness, miffed, past pains, past hurts. The gallbladder meridian, which is on the side of the eye, stores resentment and rage. The stomach underneath the eye stores disgust, phobias, and anxieties. So we found it, and so we went through and we tapped on those, and we were able to open up the energy flow and remove the emotion she had with the daughter. She goes back to the doctor. He says, I don't know what it is, but your eyes, there's nothing wrong with them.
Amazing.
So it was just
Amazing.
a blockage around her eyes because of the recent situation with her daughter. And it manifested into an eye situation, a pressure behind the eyes, which is what glaucoma is. We opened up the flow, got everything flowing, and the pressure, diminishes.
Right. That is really an incredible story. I know with myself, I had actually, it was a mechanic that I had met one day. I had a flat tire on the freeway. And I said, nothing happens by accident. So I met this wonderful person who repaired my car, and we started talking about a friend of his who he just abruptly sort of just left his wife, and he met someone else, and it was the way he kind of left. And his friend found out that when he left his wife was pregnant and had a son. And he kept trying to tell his friend, he said, look, you have a son, and I don't have any. I just have all girls. You should be so happy that you have a son. And he kept saying this. You have to be careful what you say. He kept saying, I never want to see that child. I never want to see her. He remarried. He had other children. And it's like, I never want to see them. I never want to see them. He kept saying that, and he was very young. He went blind.
Oh, see? Well, wasn't the movie with about Ray Charles and Ray Charles' blindness and
Exactly.
Jamie Foxx who was there?
Exactly.
And so Ray Charles was born with sight. And when the brother was injured and died,
Exactly.
and he witnessed it, he went blind right after that.
Exactly. And
so it was a trauma and a tragedy that he could not overcome himself because he didn't have the tool strategies. So the eyes just said, you know what, we don't want to see anymore. We saw this tragedy, and the eyes just shut down.
Yeah, and that happened with a patient some years ago who his father had left town. And with his father leaving town, actually, it was a woman. Let me just reverse it. It was actually a woman. The father had left town, and she had not seen her dad in years. And what had happened, because this was down south, and she didn't know why the father left. She was very young. And when she heard he was coming back to town, she was very happy. She went to tell all the family, and there was a small little neighborhood. Dad's coming back, your brother's coming back, your uncle's coming back, and telling the mom, look, your husband's coming back. And she was just ecstatic. She was happy. But not knowing he was coming back with such a malice in his heart that he was going to cause harm. So in order for self-defense, they had to because he came back with a gun, and they had to shoot him. And it's an ugly story, but what happened was they placed his body in the living room when he died. He's in a casket in the living room for a week. And so the child walking around the casket kept saying she never wanted to see that again. Because when they came to me, they said, oh, no, I've been blind as a child. And this is long before the movie came out on Ray Charles, long before. And when he came, and when they came, and I asked her, what had happened to her, you weren't born blind. And she said, no, this is what happened. That's what happened. And then I said, what really happened at home? And I started going back into age periods in their life. And that's when she told me this. So after that whole week, the vision got worse and worse until they actually buried, her father. And by then, she was totally blind.
Right.
Yeah, because she said, I never want to see that. And she thought that she was doing something great by saying he's on his way home. But it wasn't a great thing at that time.
Well, see, and that's what the body is. The body is so wonderful and magnificent. It will protect you at all times. When you say, I don't want to see this, the body says, okay, here's the command. I will make sure. I will protect you. You won't see this. Or same thing with infertility and such like that. People say, oh, I never want to do that to a child. I never want to have a life that I had. I never want to bring that to a child. Your body says, okay, we're not going to give you any children because you just said, I never want to have a child. So the body's there to protect us at all costs, no matter what it is, protect us. So that brings us up to another story. And not only when we're in the womb for 6 years of our life, but any time in our life. I had a gentleman, I saw him up in the nursing home. He had Parkinson's. And he was verbal in the beginning, and I was just doing cranial work on him. And every time I did cranial work on him, he was up and about and functioning and such like that. And then as he got more into the not speaking mode and more into the paralysis and such like that, I was actually able still to work with him without him communicating through the muscle testing. So I would come up with an emotion, and I would, clear it, and I'd call up the daughter. I'd say, okay, what about this emotion? What about this time of his life? Blah, blah, blah. And she would tell me what would happen. Well, when he first started getting his Parkinson's, okay, so we came up with the motion of there was a situation where somebody told him to grow up. He was an artist. And at some point in his life, at a certain age, someone said, stop being an artist and get a job and, and provide for your family. So stop being who you are. So I asked her at what age. She said, that was his second wife. As soon as he got married and he was an artist, a free spirit, she said, stop doing that and get a job and provide for me. Those were the beginnings of his Parkinson's, and towards the end, he became completely paralyzed, so he was no longer free. He could no longer do his art. Do you see what I mean? So that stored into his body. She said, stop being who you are. Stop being a free spirit. Stop being an artist. And his body says, okay, I'm going to stop, So that's just one example.
Yes. And it's just so many. And again, if you just tuned in, you're listening to the Cherilyn Lee Health Show. You can go to the Cherilyn Lee Health Show.fm. We're here with Linda Rogers, and our topic today is, can you hear me now? Your body and your life are speaking to you. Are you listening? And, a lot of times people, if you have any questions that you would like to call in to address or comment, 310-928-7733. Or if you're at work and you want to just email us or you're on the computer, you can email us at INNER, light, L-I-G-H-T radio, at yahoo.com. So we're here on the healing frequency. And again, I want to thank everyone for listening. And this show has been sponsored by Nutrimed Integrated Healthcare, located at 323 North Prairie in the city of Inglewood, Los Angeles, California. Suite number 434. The phone number to the clinic is 310-419-4300. Again, 310-419-4300. So if you have any questions, you can always call the clinic. We're open 3 days a week for your needs. And I just want to thank Linda for all of her insightfulness in sharing it with us today here on the Cherilyn Lee Show. Just want to thank you so very much. Now,
Well, it's a pleasure.
So let's just keep moving along.
Okay. So let's talk about how, because your listeners are saying, okay, wait a minute, if I'm 30, why do I react this way? Why do I feel, these emotions? Because I know better than that. So the way that the brain is designed, the way God designed the brain, okay, is in the limbic system. Okay, there's a part of the brain that stores our emotions and such like that. So let's say that something happened at 4 or 5. We, as you were saying, there's a loss of a pet, loss of a grandparent, loss of a death of something, and you have this emotion. People around you are grieving. They don't know what to do for themselves. They can't help you, and you don't have the tools and strategies. So you have this emotion. Let's just say that it's grief. Okay, and your mind, the limbic part of your system, is like a file cabinet, okay? So let's give you grief. You don't know what to do with it. You're not ready to release it, so let's open up that file cabinet and let's store away that situation at 5 years old. Close the door of the file cabinet. Okay, so now you're 10 years old, you're 15 years old, all of a sudden you're triggered, and that's what happens to our subconscious mind. We're triggered by something we see, something we smell, something we feel, something we taste, something we hear, and we're triggered, and we're right back to 5 years old. Our body and mind doesn't know the difference between imagination and reality. Opens up the file cabinet and says, remember that grief you had? And all of a sudden you're going through this grief again. You're a teenager, like, why am I doing this? And so you go through grief. You still don't have the tools or strategies, so the file cabinet shuts closed again. Now all of a sudden you're 30. Okay, now you're triggered again. File cabinet opens up and says, remember that grief we had at 5? Well, you're getting better. You've got some more tools. You've got more strategies, but you still can't handle it. So let's give you grief. Let's have you act like a 5-year-old. And you're thinking, wait, I know better than this. And then we shut the file cabinet. Now all of a sudden you're 45. Now you're triggered again. And now comes this grief again. But now you've been to classes. Now you've found out who you are. Now you've gotten to Cherilyn Lee's Health Center. Now you've, done all these different things. Now all of a sudden the subconscious mind says, yes, let's release this grief forever. And the next time you trigger it, it never comes back. So that's the way the brain goes in there, and it helps protect us. So I'll tell you one more story, Cherilyn. This one's a very good one. As I was practicing my lifeline technique, which is a technique that we use to go in there and dialogue with the subconscious mind, I was with this gentleman, late 70s, and I was practicing. I said, can I practice on you? He said, sure. He had shoulder pain. He had heart issues. So we went through and we found out that he had suffered a shock as a 4-year-old. Okay, so we went in there and we released it with the techniques, and he felt movement through his shoulder. He felt his heart. He thought, oh, wow, I feel so much better. I feel so much lighter. That's fantastic. And I thought, okay, that's good. Thank you for the practice. Mm-hmm. About, what was it, 4 or 5 months later, he says, I want to thank you. And I said, what? He said, you remember that session you did on me? And I said, you mean that practice session? He said, yeah. He said, it changed my life. I'm like, what? He said, I would have reacted a certain way in the situation, and I didn't. And the only thing different was that work you did on me. And then a year and a half after that, he said, I want to thank you again. I said, what? He said, for that session. I said, that practice session? He said, it changed my life. What had happened when he was 4 years old? Now, remember, he's 79. When he was 4, he suffered a shock that was still in his body for 75 years. But the shock was he and his uncle were walking along the railroad track, and the uncle got hit by the train and injured himself. He says to the 4-year-old, go get my shoe, okay? Go get my shoe and bring it back to me. Well, the young boy goes over to pick up the shoe, and the leg is still attached to the shoe. Okay?
Oh,
so
no.
The 4-year-old suffers a shock that he carried in his body for 75 years until he's in his late 70s, early 80s. And we just released it one time. He's like, oh, my gosh, I was never the same again, because he'd carried it for 75 years.
Can you imagine? Imagine how many people are carrying around different shocks in their system, from things they're not even aware, and wonder, why do I have this pain? Why do I have, this neck discomfort? Why do I have this sudden cough situation? And it happened around an experience when it happened. So you have to always kind of go back and get a good thorough history as to what happened. During the time, these experiences start to happen, especially some of the adult symptoms that happen, would happen around that time. And a lot of them go back to childhood, but some of them could be, a recent traumatic experience too.
Exactly. And when they talk about allergies, what they believe is from this energy practitioner model is that allergies are all about fear. Our allergic reactions are actually post-traumatic stress disorder on a cellular basis, okay? And most of the time when we develop an allergy in our adult years or, childhood, adult years, we're not born with it, but all of a sudden we develop it. Sometimes there's been a situation or an incident at the time you're eating the food, and your body goes into a response of fear. So now every time you eat that food, you now are connected to that situation that happened, so they all, you have a post-traumatic stress disorder on a cellular level.
Yes.
I always thought that was very interesting.
Oh, I think that is too. I mean, to look at it a totally different way is what really important. Instead of, we know, some sinus, some allergy. And like I said, we look at the whole scope of the picture, because a lot of it, we know too, is dental and other different things. But you look at the whole scope, and I love starting with the emotions first, because you can really, 9 out of 10, alleviate that problem a lot faster than taking a whole lot of supplements, or if you go to an allopathic doctor, they're putting you on a lot of different medications, and to really just nip it in the bud.
Well, so that's the. Thank you for saying that. There was I was at a seminar maybe a month ago, and there was a chiropractor who said, "Where is she?" And they said, "Well, she's been ill. She shows up at lunchtime." And she said, "Oh, I've been flat in the bed for a week. I barely got myself here." And it was at lunch. It was just her and I. And I said, "Well, what's going on?" So I went through and I said, "Oh, there's some anxiety." And it was 2 weeks ago, 3 weeks ago, whatever. I said, "What was going on?" She says, "Oh, we had this huge thing in the family, da da da. You know, all these things are going on." And so we scanned her body, and it was in her throat. Okay, so she was storing that anxiety in her throat. And so we went in there, we did our little release thing, and all of a sudden she's like, "Oh my gosh, I can breathe. Oh my gosh, I feel so much better." And so she may have had a bacterial infection or a viral infection in the beginning, but with the emotion also in the equation, she wasn't able to overcome it. So she said, and I was slapping down some supplements. I was taking every supplement I could, and I could not get over this. And she's like, "I feel so much better." And all of a sudden her voice and everything, the sore throat, everything was gone. So it was just another part of the equation. So when we look at
Exactly.
the whole person, we look, as Cherilyn was saying, at the toxins, at the infections, at the emotions, at the lifestyle, and we pull these things out of the equation. You know, take this out of the equation, the body feels better. Take this out of the equation, the body feels better.
Yes.
So we have
You
to
know,
treat everybody as a whole.
yes. And we have another caller calling in.
Yes.
Can you state your name and where you're calling from and in advance? Thank you for calling.
Hi, I'm Barbara, and I'm calling from Inglewood. And my question is for your guest. I'm just trying to get an understanding of Lifeline and what's the history of that practice?
Yes. So the lifeline is a technique that we can go in there and interpret the language that your body's speaking to you. Okay. It was developed by Dr. Darren Weissman. He is a chiropractor out of Chicago. Okay. And this technique, he's developed it throughout the years. And like I said, we can go in there, interpret, and discover what's going on, because any of the symptoms that we have is just what he calls symptoms of stress are gifts in strange wrapping paper. Okay, so we're given this gift of cancer, this gift of, irritable bowel syndrome, this gift of sinuses and such like that. But this is our body. Okay, is the way the subconscious mind is letting us know that something's going on in our lives. Okay, so any unprocessed emotional challenges, anxiety, rage patterns are in the subconscious mind and appear in our lives as reactive patterns, as appears disease or health issues, and it causes to have limiting beliefs. So we can go in there and through muscle testing, dialogue with the brain and interpret this language and find out where did it happen, where's it stored, how we can release it, and then we can get regeneration on a DNA level. So what else can I tell you about that?
Yeah, and that's saying an awful lot. And it's where we start. One thing, being a board certified nurse practitioner, and I do a lot of vitamin C IV therapies here at the clinic, having a wonderful medical director here also who is a physician. But I've been a healthcare practitioner, work in hospitals, in worked for the federal prison and emergency medicine for years. So I actually kind of brought a lot of my allopathic into play is what I do here. I'm not a physician. But I like to say that the one thing that I do, we spoke about the water, is that I hold the water, the IV bag, and I pray over that. I actually pray over my IVs before I give them to the patients. And knowing that the whole concept about water and how the changes and the structure changes. And I always see wonderful results when people have an IV. It's just amazing. But I know my intent is for a person to heal. And that's why I hold the bag and I pray over the bag, even though I pray with my patients also, but I do pray over what I give them. I work with a company that will do that too. And I love the fact that before they mail anything out, they love to know what is the patient's name and they pray over the products before they send them out.
Oh, I
I
love
only
that.
I only have one company that does that, and I think it's so powerful. And we have always had wonderful results with their products.
Oh, good. Well, and thank you to the caller because and that was such a beautiful lead in there, is that the lifeline technique is similar to the praying over the IVs and such like that, is that it's based upon Dr. Emoto's work, which is the
Yes.
messages in water. And what the technique is on the lifeline technique is the I love you hand mudra is for sign language. In sign language, there's a hand posture that we put which actually says I love you. Okay, and so what we do is we put this hand posture. And life is full of pain, fear, and challenges. That is what life is. Okay, when we go in there, we put this I love you hand posture over the heart. We've just now changed all the molecular structure of the water in our cells to something positive. And my interpretation is, no matter what, Barbara, whatever's going on, guess what? I love you, no matter what. And your cell says, yes, yes, I'm under stress, and she still loves me. So that's the treatment for the lifeline, is that it's, and we use the words infinite love and gratitude. Because we mentioned earlier in the program, love and gratitude have the highest frequency vibration of all the words in the English language, whereas fear's got the least vibration. Love and gratitude have the highest frequency vibration. So we then use the words infinite love and gratitude. So we can go in there and use this little hand posture and neutralize the effects of any of the negative emotions and remove them from the body. So that's so beautiful. So what they do is they write the words infinite love and gratitude on the chemotherapy, on the IVs, on the medication before they take it. And it's like saying a prayer. And that's why years ago, and some people still do, but they pray over their food.
Yes.
They're changing the frequency vibration of the food before they take it into their body.
Yes.
And so many times we get away from doing that. So we have people write on their water bottle. So on that water bottle or that glass of water that you drink,
Yes.
write on it with a marquee, with a Sharpie or a piece of tape and such, and write your intention on your water. I am healthy. I am strong. I am abundant. I am, whatever it is. And as you're writing that on your water, you've changed the frequency vibration of the water. Now as you go to drink it, you're drinking a high frequency vibration. Changes all the structure in your body.
I think that's so powerful. Now, to give the patients more of a visual, and
Yeah.
the caller is still with us, and when we
Good.
talk about lifeline, and you spoke on the hands. Now,
Yes.
give me more of a visual of what that looked like.
Okay, if you did a high five to somebody, okay, and so your hand is flat there, you take your two middle fingers and you put them down towards your palm. So the fingers that are still out is your thumb, your index finger, and your pinky, okay? And what that is I love you in sign language.
Okay. Thank you. Okay.
That's fine. And like I said, when we come, and so these are the tools that I'm going to give you right now. When we come through life, because life is full of pain, fear, and challenges. That's what life is, okay? And we have a challenge comes up. We can just take this I love you hand posture, put it right over your heart. You don't even have to say anything. And as soon as you do that, your body, it's like an instant calming. It's like, oh, yes, yes, yes. And like I say, no matter what's going on, stress, what you're saying is, I still love you. And your cells respond and say, yes, she still loves me. So it can neutralize and change everything in an instant, from something bad to something positive. So that's just one tool that all your listeners
And that's a
can
really
use.
easy tool, just to take your hand, high five it, and bring down the three fingers and leave the index.
Bring down the two middle fingers.
Bring down the two middle fingers. Okay.
So you have your thumb out, your index finger, and your pinky out.
Okay, you have the three out, and
Right.
place that over your heart.
Right.
Okay. I think
Yeah.
that's really wonderful.
Yeah.
It's just the simple things, and it isn't really simple, but it is simple, and how valuable that is for your own well-being and your own health.
Right. Well, I had a young lady, and we were at a conference, and she was there, and so I explained the lifeline, and I explained this hand posture, and she would always wake up in the middle of the night with anxiety. She would wake up in the middle of the night with just chest palpitations, so I showed her what to do. That night she woke up with the same thing. She put her hand over her heart, and just said the words infinite love and gratitude, her heart calmed down and she went right back to sleep. She woke up the next day. She's like, it works, it works.
Yes,
You know,
yes.
something very, very easy like that.
Yeah,
Very
I
simple.
do. I do some meditational work with my patients too on the phone. Now I'm going to add this technique with it also. So I thank you for sharing. There's so much, so much out there, and it's so many things that work. And like I said, the techniques is what I like, especially for a show like this, because we can give someone who's at work right now, who's going through a lot of stress on their job. They may be on their lunch break, and now they can do this simple little technique and walk back into that manager's office and ask for a raise.
There you go. Yes, yes, yes.
Yes.
Well, and you know what? So that was one of the tools I was going to give your listeners, and then I'll give you one more. Okay, is
Okay.
because as we've talked this morning on our program here about how we are triggered and how our minds are take us back to a different place where we're not conscious anymore. And just remember, only when we're conscious can we choose, okay? We can't choose when we're in the subconscious mind. So only when we're conscious can we choose. So let us say that emotion comes up, let's say frustration. And it's frustrate. You say to yourself, wait a minute, would I choose that? Would I wake up tomorrow, the next day, and choose to create my life with frustration? I'm going to be frustrated all day long? You're like, heck no. So as soon as you realize, I would not choose that, that stops the pattern just like that. So now you've stopped that reactive pattern, okay? So now you know what you don't want. So now you say to yourself, what would I choose?
Yes.
Okay? I know I wouldn't choose frustration. What would I choose? Oh, I would choose peace. I would choose serenity. So then, now you're making a conscious choice. There's power in choice. No one's forcing you. No one's making you. You get to choose. And I choose peace. So now you claim it. I choose peace. I choose peace. And now you become it. I am peace. I am peace. And that will change everything in an instant. They'll take that depression, that anger, and change it into whatever it is you want to change. Whatever you want to be in that moment, you can do that.
Yes.
So let's review. If you have anger, you say, why am I angry? Would I choose to be angry? No. Okay? You've stopped it right there. What would I choose in this situation? Oh, I would choose courage. I would choose strength. So now you've just made a conscious choice. Now you're in present time consciousness, not in the past, not in the future, but you're conscious. And you've chosen strength and courage. And then you choose it, and then you become an I am strong. I am
Yes.
powerful. And that will change everything in an instant.
And I think some of our listeners who especially have significant others should try this, because a lot of times they go home after a long day's work, and there's a lot to being a caregiver. It's
Oh,
an
yeah.
awful lot, especially if you're a single parent, too. And just to start to say this, so by the time you pick up your kids from school, or by the time you walk in the house with your spouse or your significant other, and just start saying this and watch the mood change in the house,
Right.
especially picking up children from school. And, a lot of people were wearing a lot of hats. And just to keep yourself in balance, because I was telling someone, if I went to a rally, rallies are really good sometimes, but if you don't know how to really deal with the emotional component of it, if you're really, really caught up in it, and that's what happens usually, in going to a rally, the body becomes very, very acid because you're upset, you're going through this for the rally because you're going there for a cause. So
Right.
you have to do them where there's peaceful rallies. I think, we don't even call it a breast cancer walkathons. We have breast health walkathons for men and women. So it's breast health. So when you say that, it gives us a whole different vibration, and you don't think of this C word at all, which we
Right.
don't even use that on our practice. We just call it abnormal cells
Right.
instead of using the C word at all, so that people can heal even a lot faster. But if you start saying this, you could start this right now. I am at peace, and just start this while you're listening to the show. And, sit down in your next meeting, or just as a practice, you start practicing in the mornings to start your day. I think that's a very good practice because by the time you get on that freeway dealing with the traffic and everything else, if you start doing this, the body would be more at peace. And guess what? You're not putting your body into an acid state, which everything can start to happen in the body because the body becomes very acid. Stay more, calm and relaxed, and don't pull in all these things that are just stressing you out to no end, which shoots up your blood pressure, increase your cortisol levels. Chances of developing cancers are high, especially if you stay on this road day after day after day.
That's right. And yes, they've come up with studies showing that most of your chronic illnesses is stress related.
Yes,
Stress related. Okay.
most
And
definitely.
yes. So excellent.
So that's a wonderful technique. And, if you just tuned in, we want to do a recap. We have about, I guess, 13 more minutes or so for the show. So we want to kind of do a recap so we can, just in case the person did start with us at 11 o'clock and maybe bring them up a little bit up to speed. I love the techniques. I think we need to definitely repeat that and so people can really start using those because those are real simple, especially with the water. And I mean, this is something to help you on a daily basis, starting right now, where you're sitting right now in this very moment.
Right. And what that was is that similar to what Cherilyn does with the IV bags, such like that, to pray over it, you can hold your bottle of water and just, give it a little blessing or write on your water bottle, I am powerful, I am strong, whatever it is you want to be in that moment, I am. And that will change the frequency vibration of the water. And as you go to drink it, all your cells will be that frequency vibration. That's one thing we can do. Second, when life hits us, and life is full of pain, fear, and challenges, we can put our hand, usually our right hand, in the I love you hand posture. And what that is you do a high five, take your two middle fingers, put them down toward your palm, so your thumb is still out, your index finger, and your pinky. And that's I love you. So when we have a pain, a fear, a challenge, take that I love you hand posture, put it right over your heart. We've just now changed the molecular structure in the water in our cells to something positive. And then the third thing is when we are in a reactive state of anger, bitterness, resentment, frustration, say to yourself, would I choose that? Would I wake up today and create my life full of anger? Heck no, nobody would ever choose that. That stops that reactive pattern right there in the moment. And then you say, what would I choose? Oh, I choose peace. I choose serenity, whatever it is. And then claim it, I choose. And then become it, I am.
Yes.
So those are three techniques that can change your life today, right here and right now.
And we do have another caller. Caller, state your name and where you're calling from.
Hello?
I think we have a little problem with that line there. But we do have another caller coming in. Caller, can you state your name and where you're calling from? Okay, I think we had a little problem with the caller calling in.
Okay.
They'll probably try to call back later while we still have some time here. But I just want to say that, this is what the Cherilyn Lee Health Show is all about. It's giving you techniques and things to better your life right now in this very moment. And information, because information is so powerful for our every daily living. And to know that there's such a much higher force in the universe, and to know that we can always turn to God for anything, for our healing and healing process. And if you just ask questions too, because sometimes you can't get to a healer, just ask and you can find out what is sort of going on.
Right, and just remember that the symptoms of stress show up in our body and our life, not to be feared or anything like that, but they show up in our life as gifts in strange wrapping paper. That this illness, disease shows up in your life to say, hey, you have disconnected you, and it usually is a disconnection from spirit, but a disconnection from your body. So because a lot of times what we do in life is our mind is not talking to our body. Our
Right.
body's not talking to our mind. Our mind says,
Exactly.
hey, and our body says, I'm not listening to you. And the body's
Exactly.
speaking, and the mind says, dude, I'm not talking to you. So we
Exactly.
have this whole disconnection, and when we're disconnected, that's when our body will speak the loudest and say, hey, look at me, pay attention to me. And
Exactly.
usually it is, I'm not connected, I'm not eating right, I'm not sleeping well, I'm too stressed out, all these different things. And that's your
Oh,
symptoms. Your body says, look at
exactly.
me,
And
look
I
at
don't mean
me.
to cut you off, but we do have two callers.
Awesome.
We have a Clara Parks. Miss Parks, can you please state your question? And I want to thank you in advance for calling in.
Yes, my name's Claire Parks, and I'd like to inquire as to what to do for someone who constantly seemingly has an allergic response um, of teary, itchy eyes all year long. We've tried Similazon eye drops, and that seems to help a little bit, but not totally. And they
And
also
it,
have other health challenges.
right. And so it just depends on, who the person is, and we can take a look at them and see, is there an emotional component to it? As I said before, different things in the equation. Is there an emotional component to it? Is there something going on that they're reacting to, like in a post-traumatic stress disorder on a cellular level, or is it truly an allergy, that needs to be taken care of with an allergy test or with medication or with, whatever that is. So
Yeah.
we just have to take a look and see, each person, and that's the beautiful part, is each person is their own in unique frequency.
Right. And what I would like to kind of add to that is also, if this has been going on for a long period of time, we do something here at the clinic after we deal with the emotional component, is a CRT testing, which is early screening through infrared, FDA approved for breast, but it also allows me to check the sinuses for inflammation, lymphatic, and also dental. So we've seen a lot of things that have seemingly been allergy related up into the sinus cavity, and what it was is a person had a root canal, and that has caused the problem up into the sinus cavity. So I would be interested to find out if the person ever had any root canals, because that could definitely cause a lot of problems within the sinus cavity itself. Like I
Okay.
said, the whole healing process is layers. So we look at the emotional. We definitely look at the teeth. I would really be concerned any mercury fillings or any root canals. There's a couple of books out you can look at. One is called The Root of Diseases. I don't remember the author's name, and the other book is The Root Canal Cover-Up. So you will see a lot of these symptoms in those books written by some prominent doctors.
Thank you so much.
You're welcome. And thank you so much, Ms. Parks, for calling. That was a wonderful and a very valuable question. Thank you very much.
Thank you, and have a wonderful day.
You have a
Thank you.
blessed day, too. We have another caller, um, one of my favorite people. um, Caller, state your name and where you're calling from.
Well, hello everyone out there in Los Angeles. This is Devanay Unleashed, and I'm loving what you're talking about on the show today, as far as tools that you can use to better yourself, to improve your self-esteem. But I'm just wondering, and I'm hoping that the people out there that are listening will also know and understand that we have to have a connection before we can do all of these self things that we're trying to do. Now, I'm a living witness because I tried to do a lot of things on my own, but it's just impossible unless you have a connection with Almighty God. Now, I'm just saying that, everybody has their own way of doing things and their own connection, but what I'm saying is, if you get the connection with Almighty God, that will give you the ultimate tools to make a change in your life. It's just an extra thing I wanted to put in.
Well, I think it's a very strong, powerful. I wouldn't be here today after being in 2 comas myself had not been for God. So I agree with you on that end. We do have to definitely turn to God first. And then we go, and like I said, you know I have a clinic and what I do. So, but number one, this is why at my clinic we put God first, and we go through a healing and prayer here at the clinic because I think it's very important.
Well, thank you so much, Dr. Lee. This is all I'm saying. I mean, because listen, I'm an older woman. I've been through life. I've done some things. I've seen some things, and I had to come to realize that I couldn't do it on my own. I mean, I don't care how much I talk to myself because myself can talk back to me sometimes. I can say, you know what, I'm not doing this. I'm going to be positive, and my other self will say, well, you know what, I don't think so. Not today. You're going to go down and lay down. But when I have a connection with an almighty power, that gives me the strength to say, you know what, I can and I will be victorious. So thank you so much for the show today.
Thank you so much for calling in, Devaney Unleashed. You will be on today at 1:30 to 2:30. Thank
Yes.
you so much for calling.
Thank you.
Thank you. Thank you.
Thank you. And what I wanted to add to that is what I had mentioned earlier is usually when we have an illness, disease, or a disconnection, it usually is a disconnection from our spirit, our disconnection from that higher self, that God, and each person in different religions, cultures, whatever that higher part of you is, and you've had a disconnection with it, and you felt that you had to go through life all on your own, without any support, without any help, without calling upon God or the angels or whatever, and you've had to do it all your own. And so this disconnection, when your body speaks a language, it says, hey, you're not alone. You're not alone. You can ask for help at any time, and we're there for you.
And God is always there for you.
Always.
We have another caller before we run out of time here. Caller, please state your name and where you're calling from and your question.
Yes, my name is Charlie, and I'm calling from Nigeria.
Oh.
And my question is regarding, you said root canals. So what is one to do instead of having the root canal? What is the alternative if you have something wrong with your tooth and it is very infected?
If it's very infected, what you would do is just have the tooth removed. We've had Dr. Hal Huggins, which you can go to his website, as a guest, and he's one of the kind of the godfather of holistic or integrated medicine too, from years ago. And he's been on in the one thing he said, which I thought was very powerful. If you have an appendix that's about to rupture, you're not going to go in and remove half of it. You're going to remove the entire appendix. So if you have a root canal or tooth problem, you want to have all of that removed. It's much safer to get a false tooth than maybe get an implant going back into a meridian space and still causing you problems. But the safest way to keep yourself from any problems, from the research I've seen, is just go ahead and have it removed. Again, the two books, The Root of Diseases and The Root Canal Cover-Up. You can go to Amazon and find those two books. They're very powerful books. And find a dentist in your country that will maybe comply to the treatment there. And there's many organizations that they can go to the dentist to find out more information, or even come to the United States and maybe attend some of those classes. But they just had one in Vegas not long ago for dentists dealing with ozone therapy in the gums for healing. And that would also help to heal the body. So there, like I said, many layers of healing, but I would be very, very careful of a root canal because of the end result could be some problems. Did I answer your question?
Yes, thank you very much.
Oh, thank you. If you ever have any other questions, please do not hesitate to call.
Thank you, and thank you so much for your program.
Thank you. Thank you for listening, and thank you so much for calling.
Bye-bye.
Bye-bye.
Good question.
Yes.
Good
Oh, my
question on
goodness.
root canals.
Yes. Yes, indeed.
Root canals can definitely play havoc on our bodies.
Yes, and I'm so glad we have a wonderful machine or device in our clinic, a tool, to do early screening to kind of find out. And from there, I just refer the patients over to a dentist, because I'm definitely not a dentist, and let them follow up to see where the problems really lie. Because each tooth, just like an organ, is linked to a meridian in the body also. So we want to make sure that we keep everything in balance and in harmony in our body here.
Right, and that's what we've been talking this morning on this program, is about keeping everything in the flow. The flow going through the body, through the teeth, through the organs, through the meridians. Everything is flowing, and as we're flowing through all those parts of our body, we're flowing through life with ease and grace.
Yes. And you have been absolutely wonderful, I'm telling you, for the questions that, for the information. The information is so powerful. And again, please direct your friends. If you want to listen to this broadcast again, go to the Cherilyn Lee Health Show.fm, and it will be on our YouTube channel there. And you'll be able to listen to it again. So anytime, if you have any questions, you can email us at Dr. Lee, DRLEE, FM, F as in Frank, M as in Mary, radio at yahoo.com. So feel free. Even if you want to come on as a guest, just let us know. You can always email us. But I want to thank everyone for listening in today. And I really want to thank Linda Rogers, Doctor of Natural Medicine, of being a guest here today. And her background is so extensive. Would you like to give out your website, Linda?
Yes, I don't have a website, but anyone can email me at energydoc, ENERGYDOC, at email.com. And if you say that you listen to the show, we can offer you a phone session. If you're out of the area, offer you a phone session at a discounted rate. And if you email to Dr. Lee and let us know that you're interested, we will have group sessions here at her office in Inglewood. So let us know if you're interested in that, and we will start those.
We're definitely going to be starting those next month. I have a wonderful practitioner who's going to be here on the 15th of this month. And Linda, we're definitely going to be starting with you next month here at the clinic. So I just want to say I have wonderful people around me, and I'm so grateful that we're all on this mission to help people to heal. And just hearing in the news today something that was pretty awful, I was hoping that we'd just send out some wonderful prayers of energy to different people and all these disasters and things that are happening all over the world, for their healing through the tragic loss and things that they're having right now. I have mentioned before about aromatherapy and different things too, especially for people we can't get to, because it's so traumatic when a person loses everything, and actually when you lose a loved one. And we hear all the disasters that are happening in other states. So my heart goes out and my prayers go out to all the families. And if anyone would like a session with Linda Rogers, she definitely can talk to you over the phone, which is really good, because sometimes we just need someone to talk to. So if you have a loved one in one of these states that are going through disasters, she definitely will be there to talk to them. Linda, you want to give out your email address again, please?
Yes, it's energydoc, ENERGYDOC, at email.com.
Yes, and if anyone want to call in for just prayer and healing for what's going on, you can always call us here too at 310-419-4300. And again, as I close the show, please repeat after me. I am so grateful that I am a magnet for miracles. Have a wonderful and blessed day, and we'll be back with you next Wednesday, right here on the Healing Frequency, Inner Life Radio.